Welcome everybody. Welcome dear students. This is the first lecture in PSW, and we will go right now into the main points of the personal support worker. So the personal support worker definition, like you see here in front of you, the personal support worker definition, the term support worker refers to the worker who provides personal care and support services. So who give personal care and support services, and he care about the patients with sickness or whatever, or who need assistance as well. So what is the work of the personal support workers? So this is long-term care, this is home care, this is hospitals. If you see now, in the hospitals, like 9% of the personal support workers are working in hospitals. 34% of them is working in home care, and 57%, which is the rest of them, will be working in long-term care units. So here is some different names for personal support workers. The different names depends on the type of work which they are doing. So you might find the name personal support worker in some place, but other places another names for the job of the personal support worker. So we find the main name is personal support worker, but you can find also these alternates as synonyms for the same name: home support worker, healthcare aide, hospital attendant, long-term care aide, nurse aide, nursing attendant, patient care aide, resident care worker, adult lay program worker, supportive housing worker, and community support worker. So those are different names for the same job, which is the personal support worker. Again, we'll say that the personal support worker definition refers to the work or the type of work or the worker who provides personal care and support services to people who are in need to these services and support. And we see here different names for the personal support worker. Now we will go to the personal support word definitions. If this is the only definition which we had, the first one, we had some more definitions here, like unregulated healthcare worker, backbone of the community and facility services. He's the backbone because actually most of the executive works go on this, the personal support worker. Most of the works is done through them, often have the most contact with the client. That's true. Because as example, in the hospitals or in the long-term care or wherever a personal support worker is working, he will be in a direct contact with the patient, and he will stay for a long time. Like as example, if the shift is 8 hours or 12 hours, most of the times he's sitting with the patient. Nurse come from a time to time, but all the time he's sitting in front of the patient, keeping his eye on the patient. Whether the patient needs anything, he is there to support and give him as example. He need a pillow, he need to change his situation, the way he's sitting, to posting him or whatever. And also, okay, you need a cup of water, the times of meals, the times of assisting in giving drugs, but not to give drugs because this is the work of the nurse, but he assists, like remind, or if something happened, emergency, he's the one who press the bell and so on. So there are a lot of works, and he's sitting in front of the patients. He's sitting in front of the patient, focusing on the work with the patient. We have approximately 100,000 personal support workers. They give care in all Ontario province here. Over 90 of them are women. 90% are women. Mostly of the men, they work not in home cares, but they work in hospitals. Large, I mean, I'm talking about the males, not the females. Females are working home care, mostly are working home care. Large are immigrants women, most of them are immigrants. Large number of immigrant women, particularly from Ethiopia, Philippines, some Indians, of course. Those are the ones who's working as a personal support worker. Over 60% are 40 years of age and older than 40 years of age after studying in Canada or modifying their own certificates will be able to work as a personal support worker. Again, let's go back to the first page and say what is the definition of the personal support worker. Here, the term support worker refers to the worker who provides personal care and support services. And we said now where they are working, and we said we have three places, mostly three places for the work. The long-term care, and this is the majority of them, which is 57%. So 57% of the personal support workers work in long-term care units. 34% of the personal support workers work in home care. And the rest is 9%, they work in hospitals. They work, as you can see here, the majority in the long-term care. So this, the blue part of the pie, looks like the majority of the personal support workers are working in long-term care units. We saw also we have a lot, the backbone, they are the backbone of the community and the backbone of the industry, the health industry. They are also on a communication, direct contact with the client. So they are the blue collar for the work of health. They are the blue collar for the work of health. By other meaning, they are the one online. Online means they are on the spot, on the sitting, and with the direct communication and long contact with the client or the patient. We had also here some information about the personal support workers that mostly of them are over the age of 40. Most of them are immigrants, and 90% of them are women. And in Ontario only, there are over 100,000 personal support workers are working there. That was for the first part, which we talked about just now. And before we go to the duties and responsibilities, we will just have here two questions to answer them. Define PSW, the personal support worker. State the different names, sorry about that, different names or the alternate names of the PSW of the personal support worker. Where do the majority of PSW work? So we said the majority of them, they work in long-term care, The majority of them, they work in long-term care. Here is the three questions, and I will stop here. For you guys to answer these questions, you can also Google search for more and write notes for yourself. You just write notes for yourself. You may go ahead and write notes for yourself about this point, so that we will cover whatever we will have here, we will cover with some few questions as a feedback for us. So the first question is define the personal support worker. State the different names, another alternate name for the personal support workers, like we said here. There are a lot of names like home support worker, healthcare, hospital attendant, and so on. Also, the third question, where does the majority of personal support workers work? And we said the majority of them, they work in long-term care. LTC means long-term care units. And 34% work in home care, and 9% only work in hospitals. That is for the personal support work. We'll stay here like around 5 minutes to catch your answers. Please put your answers in your notebook, just write inside your notebook, make notes while you're working. You can Google search also for extra info if there is, you can, for more details, you can go also for the websites and check out, you can write some points more That's what I guess. That's what I guess, and that's what I propose. Thank you so much. I will stop here like around 5 minutes. I will stop here like around 5 minutes before we move into the next part. Let's go ahead, guys. Again, the questions define the personal support worker, say the different names of the personal support worker, where do the majority of personal support workers work, where do the majority of them work. We are back again. Now we will go to the PSW's duties and responsibilities. What is his duties and what is his responsibilities? The people who are working as personal support workers, they have duties and they have responsibilities. So now we will see the personal, first we'll talk about the responsibilities of a personal support worker. Support worker general responsibilities, depending on the jurisdictions in which they work, can be grouped into 6 categories. First category, personal care. So here about the people who needs to have care in health as a health care providers. Two, support for nurses. They help the nurses, like we said before, nurse aid, and other healthcare providers. Third, family support. the family support as well, support families. Social support, since the person is a part of the society, then they are also working as social supports. Housekeeping, as example, when they do the works like stuff cleaning, light cleaning, or making the foods or whatever, all these foods like, as example, I used to work in residence, and in the residence here, retirement residence. And the retirement residence, we use as PSW to clean the place. So every one of us must clean and also make the beds, bed making, and washing the dentures. We do a lot of works for the patients as well. And documenting and reporting any basic assessments. As example, the intakes and the outflows, like intakes like how many times they drink water, how many times they drink, what they eat, and so on. You can register it, and also you register or record in a sheet the outflows, like as example the urine or whatever, how many times he or she went to the washroom and they urinated, they had urine, and so on, and the amount of urine as well. We register it, especially in the cases like who has kidney failures or have problems with his bladders or her bladder. In that case, also we have to, as personal support worker, to register the amounts. Also, we use to scale and register, record the weight of every patient, especially in the hospitals in the early morning, like 6 o'clock in the morning. One of our duties is to check the weight, see them put the scale and see their weight, and record all this. So these are documenting. Documenting means that you put everything on the sheets or on a paperwork. Personal support worker role. So what is, we said the responsibilities. We talk about the responsibilities of personal support worker. Again, I would say personal care, supporting for the nurse, supporting the family of the patient. Also has a social support, since the person is a part or an individual in the whole society. Also, we do light housekeeping, and we document, record the data of the patients. Like I told you, their weight, their intakes and their outtakes, like as example, the urine or whatever. So we have to register all this. What did they eat? What, so on. The PSW rules, the rules of a PSW, which is very important, the rules of the PSW. The rules is very important because you make a difference. It's very important in people's life, because the care is one of the most important things for the people to survive, especially the patients, people who are sick. Ultimate goal of support work, to improve the client's quality of life. Yes, to improve the quality of life, like here, to improve the quality of life. Provide care in kind. You don't do it as mechanically, or you do it with a sensation. You do it with love. You do your work with love, and you make yourself, like the client or the patient, feel that you really love him or her, and not only you're just doing a work for earning your living. No, you love what you are doing. Sensitive and understanding matter. Of course, you have to be also sensitive and very, very wit and understanding what your client or what's your patients. And you, from some of my experience about the long time contact with some clients, you'll be experiencing about what they like, what they hate, what they prefer, what they don't like to eat, what they when they, the times they like to go to sleep, when the times they like to brush their teeth, when the times they like to read, and so on. Because with the long time contact or long-term contact, you will come to know many of the habits of your own patients. Honor the client's rights to confidentiality. That means keep your clients or your own patients' data secret and is private. Respect the privacy of your patient. Display empathy. Always show the love and show the care from the real heart to your patients. Advocate for clients speaking or acting on their behalf. So yeah, so these are the rules that you have to talk and you have to take. So these are your rules. Before we go into another part, we will here have another question, which is very important. Describe the duties and responsibilities of the PSW. The PSW. So here I will stop like around 5 minutes to have this answer. So please go for the answer of this question. This is a very important question. I will just stop here for you guys to answer this important question. The duties and the responsibilities. Duties and the responsibilities. Remember, we said here about the duties and the responsibilities. Here it is. This is the responsibilities. 1, 2, 3, from 1 to 6. And we have also the duties also, and the rules is here to be considered when we are talking about the duties and responsibilities. I will give you about 5 minutes to write your notes before we move into the next part. Thank you so much. Describe the duties and responsibilities of the personal support worker. Describe the duties and the responsibilities of the personal support worker. Here is the question again. Describe the duties and responsibilities of the personal support worker. Perfect. Beside what we talk about also, we have here about the personal support worker, some things we just want to talk about it. Also here, let me enlarge this PowerPoint so that everybody can see what we're. Personal support worker, this is the job description now. Job description is usually including the contents of the job or the things which must be done by the job. The personal support worker job description will always vary, but in general, some of the common duties. Look at this now. These are the duties of the personal support worker. Following the care plan, observing and reporting any substitution. This is very important, very, very important. Following the care plan, observing and reporting any substantial findings and or changes in patients or residents or clients' behavior to the appropriate registered member of the healthcare team. So while you are working as example and you found, let's say, you find a kind of behavior from your patient, you are watching your patient, he's breathing, is abnormal breathing, he's having a snoring while he's sleeping very hard, or a voice of snoring, not a regular snoring voice. You noticed something is changed name, like he's having hard, to take his breathing is giving him a hard time. He cannot breathe very well. You find that he's in pain or something happened to him, or he's pinpointing on a point that's paining him or whatever, and etc. So if in all these cases, you have to report it directly by pressing the bell into the nursing station, and they will come and investigate what's going on. So you have to report everything regarding the client. This is also registered member of the healthcare team, because as he will be is one of the family who's working for the healthcare providers, or one of the healthcare providers. So his responsibility is to report to the nursing station, to the to his bosses or his employers about this case or about what he's watching. So here, appropriate registered member of the healthcare team must be a knowledge about what's going on to the patient. If the personal support worker find any abnormal behavior or something is changed in the patient's behavior, he must report it on the spot. Working under the supervision of a registered healthcare professional, such as a registered nurse or a registered practical nurse. So either RN or RPN. RN is the registered nurse, or PN, registered practical nurse. So those are the employers or the bosses of the personal support worker. And if he find anything, he must report to them on the spot. He found any changes, any deviation, anything's abnormal, he must report it into the RN or to the RPN. Third thing is performing tasks delegated to them. Anything is left is, as example, I started my shift right now, and the first thing is just to make sure that the client is situation as sitting is okay. He need posting, as example, is to post him is to just to move him to sit properly and not that his feet become away out of the rails of the bed, the back rails of the bed. He has to be in the center of the bed, so he need posting. Is the sheets clean, which he's sleeping on? It's like a rubric. Did he take his medications? Did I hear before I start my shift? Also, I have to hear from the previous personal support worker or from the previous nurse what should be done and what happened in the previous shift, and what am I supposed to do on the next shift. Performing tasks delegated. So you will know the tasks from your employer, your nurse, or the practitioner nurse, or the registered practical nurse, or from the registered nurse. You know what you have to do with the patient. That's before you start your own shift. The fourth thing is assessing with ambulation, positioning, which is posting, and transferring using mechanical lifts such as the Hoyer. So one of the main jobs of the personal support worker is to know how to use the Hoyer. And the Hoyer is kind of like, it's kind of belt, has to be fitting for the person and fix it to him. Then you can raise him up with that Hoyer, and you can move the Hoyer into places like going to the washroom or whatever, and the patient, then put the patient down and let him They can do his washroom or whatever. So here, also assisting with ambulation. People who was ambulated, they cannot walk, so you can help them to walk using the canes, positioning and transferring using the mechanical lifts like the Hoyers, and we'll see the Hoyers later on, and we'll see how the Hoyers will work. That is for the moment. That is for the moment, and shall go for the next video. Thank you so much. Shall go for the next part. Thank you so much.